operations that correct deformity in the nose. Most of the patients have three demands. It's mostly the dorsum haunch that is most frequent, and then the unattractive tip, that's mostly large and big, and the width of the whole nose. Yes, it's true that rhinoplasty is the most frequent surgery in the Middle East because of the nose in the region are big, so we tend to make them smaller and more attractive and in harmony with the whole face, while keeping it a little bit unique. Now we try to give the patient the nose they need. Actually, you can do a cute nose, but what's more challenging is to do a cute nose that goes well with the rest of the face, what we call the harmony. So this is the hardest part, and to keep it unique. Like, you don't want to do copies for everybody, like the same cute small nose. Okay. So make it a little bit unique is the hardest part. Mostly patient will not ask, I want this nose. They tell us their problems, like what bothers me is this dorsum hump, this tip that is big or unattractive, and I tell him what I can do according to what's going to be more in harmony with the rest of the face, and what's going to look, the whole face is going to look cuter and better. There are different techniques. We can do it on closed surgery, we can do an open approach, or we can combine open and closed approach. It depends on the problem, on the deformity, and on the patient. It takes almost an hour to do a nose. The anesthesia used during the nose surgery is either local anesthesia with IV sedation or general anesthesia. It depends on the demand of the patient. Okay. The patient before the operation needs to, of course, stop taking any anticoagulant like aspirin 1 week before, and he needs to see an anesthesiologist to make sure there is no medical problems, and he needs to do a small blood test. Before the operation, I just have to see the patient, explain to him what are the outcomes, so he knows what to expect, and I have to take some photos in order to put them during the surgery. It helps us. Well, we can start the operating people whenever the nose, like the growth of the nose, comes to its end. For young ladies, we can start at 17 years old, and for young guys, we can start at 18 years old. Rhinoplasty is a surgery, and every surgery might have complications. Like, first you're gonna have ecchymosis around the eyes and swelling, but this is normal after the operation. The ecchymosis goes after 1 week, and the swelling goes progressively in a few months. And after 6 months, you'll have the end result. Besides these complications, you have like minor complications like bleeding, infections, hypersensitivity. You can have skin necrosis. You can have a bad result. In 10%, there are patients that are not satisfied, so you have to redo the operation. The nose is in the middle of the face, so whenever you go and take photos or whatever, people look at you, they will see this nose. So whenever you have like an unattractive nose, people will feel it, and you're gonna feel it. So whenever you correct this, you will feel it, and your self-esteem will go really higher, and you're gonna have so much confidence in yourself. People after the rhinoplasty came at us and like thank us, and you know, some people says like, you changed our lives, like they are more confident, it have an impact on the work. Others had an impact on their love life. Some people like, I got married after doing my rhinoplasty. So you know, it's the impact, the positive impact.